Hello and welcome to our talk on questions about your medicines, including the patient medicines helpline. First of all, let me introduce myself. Firstly, I introduce my colleague, Andrea Griffiths, who you just saw. She's the lead technician for medicines information, patient safety and formulary. She's been in pharmacy for 30 years. And includes in community pharmacy. She's worked at UHW, or as we call University Hospital of Wales, or some people know it as the Heath Hospital, for 26 years, and that has included various areas of pharmacy within the department. I'm Joanne Hubbard. I'm the technician in Medicines Information. We now call ourselves Medicines Advice Centre, so we're MA instead of MI. And I have worked in pharmacy for 42 years, including community pharmacy to start with, where I did my training, and I've been at UHW for 38 years. And I also have covered all areas of pharmacy, but I'm now just based in Medicines Information, or sorry, Medicines Advice. So many years of saying the same thing, it's quite difficult to go back to something new. Anyway, thank you for inviting us both along today to talk to you about our patient medicines helpline based at the Welsh Medicines Advice Centre at the University Hospital of Wales. And we provide this service to patients and carers and citizens who live within the locality of Cardiff and Vale, and for patients who live outside of the locality who are receiving treatment from any of the hospitals within the Cardiff and Vale Health Board. I need the next slide, please. Right, okay. So why was the service introduced? The service was promoted from the Care Quality Commission's report in 2009, which suggested that patients may find it difficult to adapt to complex medication changes and that support and guidance should be offered. Although our community pharmacies are ideally placed to help, they are not sometimes aware of the changes in a timely fashion, and communication was found to be of a poor quality. The following situations occurred. Patients were not taking their medicines correctly, and poor compliance led to financial burden. Readmission back into hospital was an issue because patients were confused about side effects. Patients often had difficulty obtaining repeat supplies due to poor and untimely communication. The uncertainty of how long to take their medication and the difficulty of understanding instructions. Therefore, it was deemed essential to have quality information at the time of discharge or on receiving an outpatient prescription, and the immediate time after this was when the patient returned home and were likely to ask questions. In response to this report, a pilot patient helpline was set up on the 7th of May 2013 for 6 months, led by 2 pharmacy technicians. Moving the service from the dispensaries within Cardiff and Vale UHB to the specialist services of the Welsh Medicines Advice Centre, or WMIC, as I said, we were formerly known. Ensuring from a governance perspective, all calls were recorded and documented. Leaflets advertising the service were placed in the bags of all take-home and outpatient prescriptions, and evaluation was then conducted after the 6 months proving the service to be a success. Okay, so if we fast forward 10 years later, the service is stronger than ever. Our opening times have increased, and we have had to adapt to changes within pharmacy that has resulted in different types of inquiries that we now take in. We now have a number of multidisciplinary staff who are able to use their specialist skills to answer these varied questions, and we have made the service more accessible by increasing our opening hours, including weekends. We still advertise our services by placing these cards into all patients' take-home prescription bags and outpatient prescription bags. You can see a copy of the times we're open there on them. And our services can be found on our webpage, and that gives you the web address. If you'd like to have a look at that at any time, please do. Betsy Cadwallader and Hywel Dda have dedicated helplines as well. However, other health boards do have ways in which members of the public can contact them, but these are mostly based within their own dispensaries and not a specific service. So the types of inquiries we receive, we often get inquiries about drug interactions. For example, we all do this, I'm just the same as anybody else. When you get something from your doctor or your pharmacist, you read the patient information leaflet, and they're quite complex, those leaflets, and sometimes it's quite scary reading them. So we've read, and then we often read information that contradicts with the medicine that we may already be taking, or that we may want to start to take a herbal supplement alongside their conventional medication. Clarification of drug administration. People need to know about how often to take, stopping and starting, and to take with or after food is a common question we get. People need to know the clarification of the dose prescribed. So is the dose escalating or is it being reduced? Adverse effects, we use this opportunity to promote the yellow card scheme. If the patient feels confident to complete, we provide them with the relevant information, or we can complete a form or we'll complete on their behalf. So if you do have an adverse effect and you feel like you'd like to report it, and we'd love to hear all the reports, then please have a look at the scheme. I'm sure Andrew will talk to you later about that. We also have a lot of issues these days on supply, because that seems to be a big problem at the moment, with the manufacturers being able to get supplies, patients running out of medication. So we work with our procurement departments, and quite often we will contact the manufacturers directly to find out what's going on, and if they can give us timescales of when drugs will come back onto the market, or what to do in the meantime if they can't provide the drugs. And often advice is given that we can have a look at, or you can go back to your GP and the GP can then decide what treatment is best. The types of inquiries we also receive is dispensing errors. We always ensure a DATEX, which is an electronic error form, is completed. So we always maintain patient confidentiality while doing this. And all errors are taken very seriously and escalated to the appropriate departments depending on the severity. So it's not a case of people just saying that, oh, we've had an error, and we think, all right, okay, we've sorted that out, end of that. We do make sure that we do go through a very strict process, and then we can also give people the outcome of what's happened in the end to help with that. Post-discharge advice issues, advising why a medication is stopped. Maybe they've been on something in hospital, but when they've come out, they haven't. So they want to know why they've been stopped, investigating why a take-home prescription has not electronically reached the GP. And that has been a big issue for us as well, because although this in this day and age of technology, we're still finding that things are not getting as quickly as we would like between hospital and GP, so the information is not there. And simply explaining how to get a repeat prescription if the communication at the point of discharge has been poor. And also the types of inquiries we receive are about the common ailments questions that you can go to your pharmacists to find out about.
Thank you, Jo. I think it's my turn now, isn't it?
Yes, thank
you. So Jo and I sort of share a very common role, but I'm actually patient-facing technician as well. So I do awards, and I also work in the dispensary on the weekends. So I'm very sort of grounded with some of the issues that come through, and I see these on a daily basis as well. So Jo has gone through the types of inquiries we receive. So who we refer to. So for us as technicians, and well, for anyone really, it's knowing your own limitations. And if we're ever unsure, we always escalate to a more senior member of the inquiry answering team. We would never ever second guess an answer, and we always use trusted resources. We use members of our pharmacist team for specialist advice. We have a wealth of knowledge. We're really, really lucky within Cardiff and Vale. So for example, if we do have a question from maybe a patient who's had a renal transplant, rather than it taking us a couple of hours to look at this inquiry, we are able to refer them to our specialist team. We'll answer that question in a fraction of the time. We do refer back to the ward staff and the doctors at ward level. Sometimes patients will receive conflicting conversations and messages, and sometimes last minute decisions are made at the point of discharge, and the patient isn't always informed of these changes. And we do have telephone calls where patients are maybe expecting a course of antibiotics or a certain painkiller. And whilst we're able to access the information, sometimes, you know, the information isn't documented, so it is necessary for us to refer the patient back to the ward. Another example is if a patient has been discharged that day and they're taking something, for example, 4 times a day, and they're wondering when their next dose should be. Usually we would refer back to the ward the patient had been discharged from. Their drug chart's usually there, and they'll get the information from them. And sometimes, you know, it's really necessary for that patient to go back and speak with the doctor, because there's been such a you know, understanding between them, and that's something that we can't help with. Our community pharmacies are a valued source of advice and support for us as well. So they're able to advise on common ailments. And if anybody is interested in the common ailments scheme, there is a link there, but you know, you can Google this. And within Wales, I think there are some treatments that are free. So you can go to your local pharmacy, for example, if you feel you've got eye infection or something like athlete's foot, that, you know, might prevent that long wait in the GP queue in the morning. And they can hopefully sort you out with something over the counter there. And again, we sometimes refer our patients back to our community pharmacist colleagues, because patients have been going there for years and years, and they have a really trusted relationship with them, and they do trust them, you know, with their medicines. And sometimes if they're unsure when changes have been made, it's, you know, a more convenient way for our patients to talk to a healthcare professional. For medication reviews, we do have pharmacists who are based in GP surgeries. These are called cluster pharmacists. And again, you know, sometimes multiple changes are made when patients come into hospital, or patients come into hospital and go out with a new set of circumstances and a new medication regime to stick to. So there is support within GP surgeries from these cluster pharmacists. We quite often refer to other healthcare professionals, such as opticians, dentists. There's specialist helpline for patients who have certain medical conditions. So for our haematology patients, Macmillan is a fantastic resource. Also, we've got rheumatology clinics, to name but a few, usually led by specialist nurses and pharmacists with a wealth of experience and knowledge there. We do refer our patients to GPs if we feel the patient would benefit from a clinical consultation. I think sometimes when patients ring our number, they sometimes Google medication and they're not quite sure of the service they get. And our service looked a lot different during COVID, and we were finding that patients were ringing the GPs, and sometimes the receptionist would give them our number. And I think people were expecting that there would be a clinician within our service who would pop up on the screen and have this conversation. And that's just not the case at the present time. So we would then refer the patient back to the GP if they, you know, we really feel they require a clinical consultation. We also promote our out-of-hours services, such as NHS 111. You know, we do get calls late in the afternoon. And obviously, and this doesn't happen very often, we advise the patient to ring 999 if a patient is acutely unwell. And we also refer to the patient concerns team as well. It might not necessarily be a pharmacy related concern. It may be a concern, about a service which, they've attended, but they are a really good point of contact and they're a good source of information for us as well. So just to finish off then, the Medicines Helpline was set up specifically for providing advice for medicine related issues, and the onus is very much on the word help, and we help where and when we can, even if it's not medicines related. We will always try to redirect our users to the service they require, and we will always try and take the time to establish their needs, listen, and to advise in the best way we possibly can. I think the majority of the time, our citizens, our users of the helpline are always really grateful for the advice provided, although sometimes it might not be the outcome they expect. But I think the beauty of having the helpline is that they always speak to somebody. We always try and aim to pick up that phone within it ringing 5 times. So we're kind of coming out of our post-COVID periods now, and we're looking to the future. And as always, we will continue to adapt to changes in pharmacy practice, and we will continue to audit the service. This has slipped, I will say. In the past, we've sent out surveys to patients, and this is something that Joe and I are keen to pick up in the coming months. Our medicines advice service will change, with hope that other medicine advice services will implement dedicated helplines. As Joe alluded to earlier on, there are 3 that are dedicated within Wales, but for patients, they should always ring their pharmacy department for help and information if they do have problems. We are having new technology which will enable centres to deliver the service differently and will provide users with a better experience and for greater empowerment. And this is about patient empowerment. People do ring us because they're worried, they're confused, and they get home and things are very different. And being a technician at ward level, people do listen to you, but it's the reality of sitting down and processing what's happened to you and sitting there. And I think they sit there with their medicines and think, right, where do I go now? What do I do next? And we're there at the end of the phone to help them. And we're also looking at the introduction of a chatbot, which may be a more convenient way for users to access the service at different times of the day. And I think this is something that we're really looking into, and I think it's something that other centres use as well. May not be popular with some people, but there will always be somebody at the end of the phone. So before we go, we would like to say that feedback is really important to us, and we would be very grateful for your feedback today. We would be grateful for any comments, ideas about what patients really would like. Are we missing a trick here? Is there something that we could do better? So our email address is there. You can Google us, and if you could feedback to Joe or myself via the generic email address, again, we would just be really grateful. So thank you for listening. And does anybody have any questions?